Working telehealth as a new grad psych NP isn't impossible, but there's definitely a couple things you would probably want to ask in the interview or onboarding process to make sure it's a good fit. Because with telehealth, you are kind of out on your own, so you want to make sure you have appropriate support in place. One of the first things I would ask in the interview is, what does the mentorship or supervision look like? Whoever it is, whether it's your collaborating psychiatrist, the clinical director, whoever it is, are you meeting with them weekly, bi-weekly, monthly? Going over difficult cases, doing case reviews and things like that, just like checking in so you have someone to bounce ideas off of, because sometimes you cross things that you've never crossed before and then it's a learning experience. So having someone who's been through it already can be super helpful. What you don't want is a telehealth job where you have no supervision, no one to turn to, and you have questions, you don't have anywhere to turn. The other thing I would ask for is onboarding and training. So do they offer any trainings? Like, are they helping you learn the EMR? Are they explaining protocols? You're going to come across a lot of different things. And again, with outpatient, you have to know whether a patient is appropriate for outpatient, especially telehealth. Not everyone's appropriate for telehealth outpatient. Do they need a higher level of care? Are they in crisis, and what those things look like? So are there protocols in place for crisis management? Crisis management is a big one. If someone comes to you and you're concerned they're in crisis, there should be a proper protocol in place for an outpatient telehealth. The other thing with onboarding is, what's the onboarding process? Are you just going to have 40 new clients out the gate, or are you going to build up slowly so you can kind of learn the flow, learn the process, and you're not going to be swamped and overwhelmed? The other thing I would look for is what the population is. Is the population mainly like adults and it's just depression, anxiety, and things like that? Or are they high acuity patients who are just getting out of the hospital, PHPs, IOPs? Is there schizophrenia, bipolar, things like that, where they have a whole, case management team? Starting more simpler, right, and then working towards complex can also make or break your experience working telehealth. Again, these are some things I would look for after talking with different new grad psych NPs, and things I would have liked to know if I was going to work as a psych NP in telehealth.